Just Dr. Buford. We're just getting started on your left shoulder. We're looking in from the back to the front. Before we started, we confirmed that you had some significant instability towards the back of the shoulder, not so much towards the front. I think most of the instability we noticed towards the front was because of the looseness and the laxity in the inferior glenohumeral ligament, and not so much from a straight anterior instability. What we're doing here is we're using this instrument called the shaver just to smooth out some of these frayed areas. I want to look at this biceps anchor area and make sure that that's not loose. It's a little thin, but it doesn't look detached. And there's a little bit of evidence. Yeah, I think we're going to have to fix that too. So what we'll do is we'll use our shaver here to remove some of the cartilage. Show you some more in just a minute. Okay, here we are looking towards the back, and we can see this tear in the posterior labrum. And this is also part of the reason we're here. So we're going to get to work on that first. You can see how that tear in the labrum extends all the way up from 6 o'clock, which is down at the bottom and kind of in the middle of the screen, all the way around the side here. So we're going to go ahead and put the camera in the front. We'll go off on the video just for a minute. Okay, so as we look from the front to the back now, we've got this yellow cannula coming in the back. It becomes a little bit easier to see the tearing in the labrum that you've got. So we're going to smooth that out like that. And then we're going to work down here on this part of the labrum that's torn. That gray cannula will push in between the two bones here. It helps separate the bones so we can work a little bit better. Surface of the rotator cuff, not really enough to be classified as a full thickness tear or anything like that. Okay, so now we're going to look down at this posterior labrum and decide if we need to attach it or just put in some suture anchors, or what exactly needs to be done here. So I'm going to take a spinal needle and we're going to check and see what kind of angle we need to have to place a suture anchor down. Looks like that's not a bad shot, and that gives us this type of angle down into the bone. So we place one or possibly two anchors in. So we'll go ahead and get to work on that. I'm going to use the... Okay, so here we have a drill guide, and we're going to drill down and make a hole for the first suture anchor. You can see we're below the equator. We're hopefully down in about the 7 o'clock position. And with the mallet, we'll just tap this anchor down. And there's the anchor. Now to seat the anchor, we have to pull back on it. And that now feels very solid. We'll go ahead and take out one of the sutures. Need a pincher tool. Okay, hold that camera. just a minute. Pause, please. Okay, so here you can see we've got one suture inside the cannula in the back. The next step, we can leave this other suture actually out of the way. The next step is to take a suture hook, which is a little needle, a hollow needle that's curved. Here it is here. It's loaded with a black wire called the super shuttle. And this is what allows us to pass the suture through the tissue. I got this if you can lift up. And so here we can see the, pause please. Okay, so we've got the first suture passed. And now we're going to go ahead and make another stitch. You can see the first one where it's located down really almost at 6 o'clock. We're going to pass another stitch to the right, or actually really to the left, a little more superior. So we'll go through like that. And then this one we're going to bring underneath. So this is a figure 8, what we call a figure 8 mattress type stitch. It's a very strong suture technique that we use whenever somebody has this type of laxity. So we'll grab the wire. And so now outside your shoulder, we're going to go ahead and load the wire with the other end of that, the other end of that suture. There it goes there. So we'll go ahead and take a grasper. So that gives us our figure 8 stitch here. Let's see how that looks. And now we're going to go ahead and tie that knot to secure this. We'll get this suture here. And so this will be our first stitch. It's really going to tighten things down nicely, I think. We're going to place one more back here for sure. We'll go off on the video for just a minute. Alright, we're just cutting the suture tails from the first knot. And there you can see how it looks. I'm happy with that. Now we're going to go ahead and place one more just to the left, which is slightly superior to the first anchor. Come back through the capsule again to the same hole. And we'll take this time we're using a straight cannula instead of a curved one. And we'll look at where we were. We're going to place this one right about here. Okay, pause. Okay, so here you can see the second anchor. Just like before, we're going to take one of the sutures out. And then we'll transfer that to the front. Like that. And now we're going to take our suture hook once again. There you see it. And then we're going to decide where to place this next stitch. So it looks like we need to go in right about here. That stitch. Okay, pause. Okay, here you can see as we pull back slowly, and then we're going to do a mattress stitch here just like we did before, which means we're going to bring that same suture back. Need a pincher. Yep. So we'll reach in and grab it. our second mattress stitch in the back of your shoulder. And we will go ahead and tie this now. Cut these suture tails, and the next step we're going to work on the possibly on the anterior portion of the inferior glenohumeral ligament, and also we have that biceps tendon to deal with. But in the back, that looks good. I'm happy with the way that looks. That's a lot tighter than it was. So what we may do, we're going to place a stitch right here to tighten up this part of the ligament a little bit more. Pause, please. Okay, we're going to use another suture anchor here anteriorly. Mallet this down. And there's our third anchor. We'll pull tight to seat it. It's very solid. And now we'll reach in from the back, take out the inferior suture just like we've shown you before. So there's one of them right there. And now we're going to place a stitch in that fold there and tighten that ligament. Rasp, please. Pause. Okay, so you can see we've tied this knot in the front, and that's tightened up that anterior portion of the inferior glenohumeral ligament. Very happy. We've now got a balanced repair where we've got, actually it's hard to even see down there, which is exactly the result we want. But we've got two sutures in the back and one in the front. And now we're going to look at this biceps anchor. Pause. Okay, here we are placing a suture anchor for the biceps tendon repair. It's what we call a slap repair. I just wanted to show you what it looks like here. We're going to try and mount that down. Okay. Now this anchor is a little bit different than the three that we've already shown you, in that this one's double loaded, which just means it's got two sutures. We still have to seat it the same way, which means we have to tug back on it like that. Okay, it's still moving, so I'm going to keep tugging, make sure we get it fully seated. Tugging on the blue ones, and we'll tug on the black ones. And we'll tug on both. Okay, that looks seated. So now we're going to take some of the sutures out of the way and get to work casting these. We'll show you some more in a minute. Pause, please. Okay, we're going to go ahead and tie this first loop that we have around the posterior aspect of the biceps anchor. Snug this area down, hopefully make it tight. please. Okay, so now we've tied the sutures on both sides of the biceps tendon. I'm going to put in a shaver just to smooth things up a little bit if I can. Okay, and so now we can see we've got that biceps anchored down. I'm happy with the way that looks. I just didn't feel comfortable leaving any laxity there, given that your shoulder really has some multi-directional instability. So we're going to finish up and get you back to the recovery room shortly. I really hope this does the trick for you, okay? Good luck to you now. Bye-bye.